We're recording, ready to go.
Okay. Hello, everyone. A good morning to you. I think there are people from different parts of the world. So for us, it is good evening. And for everyone, welcome to the session. I'm Rashmi Kusurkar, and I'll first share the screen so that you can also see the details of what I'm talking about. Yeah. Okay. Do you see this in? Oh, this is not. I need to share the right one. Just give me a moment.
In the meantime, we see that everybody's joining. While Rashmi is opening up the PowerPoint, we'll start together and then we'll divide in smaller groups to really get stuck in with this data approach. But I think the PowerPoint's there.
Okay. You can see it properly? Yeah. Okay, so I would like to start with introduction of the speakers, and also I would like to know who's in the audience. I would like to start with introducing myself. I'm Rashmi Kusurkar. I'm a research program leader and associate professor in research in education at the Faculty of Medicine in the Vrije University, Amsterdam. My background is that I'm a medical doctor and I did my specialization in physiology. This was in India. Then I moved to the Netherlands and I did my PhD in medical education, and Professor Ola Tenkayato was my supervisor. After that, I moved to Amsterdam to Vrije University and I started my own research group. And Anna and Marianne are part of my research group. Welcome to the session today. And what I'm going to present today is actually something which we have done as a teamwork. And I will come to the specifics later on, but it's something that a methodological approach that we explored when we use different methods in our research program. I would now like to ask Anna to, so do I need, I think I will first stop sharing.
Yeah.
Can you introduce yourself?
Hi, everyone. My name is Anna de la Croix. I'm in Rashmi's team, so at the same medical school at the Amsterdam UMC Vrije Universiteit in Amsterdam. I am with Rashmi's team. I do mainly qualitative work, but I actually also really enjoy mixed methods research. I mainly in reflection, professional identity formation, and interaction and communication. My background is in linguistics originally, so I am from the humanities, which gives me a different perspective to the journey from student to doctor. I always like using for interesting conversations with other professionals in medical education.
And maybe
Marianne.
you have heard about, sorry, just a minute, Marianne.
Oh, yeah.
Maybe you have heard about or read Anna's paper on the reflective zombie. So if you want to know more about it, you can always ask Anna. Now I would like to ask Marianne to introduce herself.
Yeah, thank you, Rashmi. Hi, all. My name is Marianne Mak. I am a general practitioner from my background, now working as a medical educator, medical researcher. I used to work at Rashmi's team. I did my PhD at her team, but I moved to another part of our university, the family medicine department, and where I'm working now on the topics of professional identity formation and diversity. And yeah, that's what I wanted to share with you.
And Marianne has a beautiful thesis on unprofessional behavior of medical students. So if you would like to know more about her work, do write to her. We have a research program which is called Developing Students for Life. So we do research mainly on how to foster intrinsic motivation among students. And there are different research lines within this program. But we have we looked at many different topics in medical or health professions education through the lens of motivation. Now I will start the, oh, sorry. I would like to know who's sitting in the audience. So maybe in the chat, you can put in, are you a researcher or are you an educator or are you in administration or policy? So if you could just put that in the chat, that would help us know, yeah, what we can present today.
I see a wide variety of locations.
Okay.
And there's Editor Charles. Mary's got to focus on assessment. Researchers, faculty development, medical humanities. Supporter for research. It's quite a lot of people.
Yeah, so I think we have people from all the possibilities at administration and educators and researchers. So I think that helps us decide what exactly we can explain. Okay, so today's presentation is about, the title of the presentation is One Size Does Not Fit All, the Value of Person-Centered Analysis in Health Professions Education Research. So these are the co-authors. This is a paper that we published in Perspectives on Medical Education. And as I said, there were different methods that people were employing in their in the research work, and through these methods, we saw a common approach and we put it together into a person-centered analysis. So these are our co-authors, and I would like to thank them for their contribution to this article. The objectives of today's workshop. The first objective is that the participants will be able to explain the aims, advantages, and importance of person-centered analysis. And the second objective is that you will be able to use person-centered analysis in your own research. So we plan to first give some information, and then we plan to have interaction in groups where you can have some hands-on experience. The format of the workshop, I think the first part we have already done, that was the introduction. Then we'll have a plenary session. We'll go through the person-centered analysis approach, and then we will go into the 3 methods. And then we'll have an interactive discussion in 3 subgroups. So we'll have the first subgroup, which will be led by me, and that will be the first method, cluster analysis. The second subgroup will be led by Marianne, which is will be on latent class analysis. And the third one will be led by Anna, which will be on Q-sort analysis. So these are the 3 different methods which we are going to explain under the heading of person-centered analysis. And at the end, so when you are in the groups, we would like one person from the group to report back on what was discussed in the group, and then we can have some take-home messages. So what's the background? Now, all of you know that research conducted in health professions education predominantly employs variable-centered analysis. Now, when I say variable-centered analysis, what do I mean by it? It means that that type of analysis investigates the relationships between 2 or more variables in a given sample. So the whole sample is taken together and the relationship of one variable is tested against the other. And this is important in understanding how variables in health professions education research can influence one another. So it could be empathy is associated with better performance, with better communication skills, or not, etc. So it is the relationship of one variable with another in a whole sample. Now, what is the problem with this analysis? It is an important type of analysis for us to know which variables in education are related with each other. But it can be hard for educators to adapt or change their practice on the basis of such analysis, because the implementation of the recommendations of big studies, these can be quite difficult at an individual level. What is person-centered analysis? So we present person-centered analysis as an additional approach. So we are not saying that the variable-centered analysis should be replaced by person-centered analysis, but that person-centered analysis is an additional or complementary approach. And this approach investigates how subgroups of individuals can be made, and based on that, how variables are related to each other across groups. So groups of individuals, subgroups are made within a sample, and then you test these subgroups for what are the differences between these subgroups and how are they related to different outcome variables. A person-centered analysis generates findings that could provide educators with tools to personalize practice initiatives, because you don't look at the sample as a whole, but within the sample you look for patterns, and then you find these subgroups, so you can personalize any practice initiatives as per each subgroup, as per their needs. Researchers can use 3 methods for person-centered analysis: cluster analysis, latent class analysis, and Q-sort analysis. Now, what does variable-centered versus person-centered analysis look like if you compare them? So this is what variable-centered approach is, in which you take a sample, you collect data, and you look for, is motivation among these participants associated with academic performance. So that the example is, we are looking, or we are investigating the association between motivation and academic performance. So in a variable-centered approach, you take the whole sample and you see motivation, is it related to academic performance? Whereas in a person-centered approach, in the motivational variable or among the participants, you look at, are there different types or profiles of participants? You put them together on the basis of characteristics that they share, and you make profiles. And then you make these profiles as the independent variable. That means something that influences the outcome variables. And then you test the outcome variables. Outcome variable is like academic performance. What is the relationship between profile 1, 2, 3, 4, or whatever number of profiles with the outcome variable? A picture, a nice diagrammatic way of representing this. You can see this graph was shared with me by Tony Artino a few days ago, and I thought, oh wow, this is the perfect thing for this particular presentation. And if you see the red line, that is, so there is variable X and there is variable Y, and we are testing in a sample what is the association of variable X with variable Y. So you see the red line that forms, that's showing a linear relationship. That is what comes out of a variable-centered analysis. So what we lose in a variable-centered analysis is, if you look at the Simpson characters, you see that there are groups which are being formed. There are some people in the group which are similar to each other, but they are different from the other group. So you can find patterns or subgroups within this sample, and then each one of these groups will have a different relationship with the outcome variable than you expect. So variable-centered versus person-centered analysis gives you a different look or perspective of the data. Now I would like to again compare variable-centered analysis with person-centered analysis. And you don't need to read the whole thing. I just want to show you, if you take the same question, how can we answer them differently and how can the methods be applied? So the research question is, how is empathy in health professions education students associated with clinical performance? Now, when we look at this question in the person-centered analysis, I've just added a small question ahead of it. Can we find patterns in the sample? So the question is the same, but we are now looking for patterns in the sample. You collect the exact same data. That means you collect scores on empathy using Jefferson's scale of physician empathy, for example, collect clinical performance scores, and then for the variable-centered analysis, you run statistical analysis for association between the independent and dependent variables, that is empathy and the clinical performance. And you do this for the whole sample. Whereas in a person-centered analysis, what you do is you collect the same scores, but you handle them differently. So you divide the sample into subgroups of similar scoring students using a cluster analysis. So within the Jefferson scale of physician empathy, the scores can be different from each other. So you put people who have the same scores into one cluster and people who have different scores into a different cluster. And then when you have these clusters or subgroups, you make the subgroup as your independent variable and you run the statistical analysis for association for the subgroup membership as an independent variable and clinical performance as a dependent variable. So you might actually find that students who score high on empathy have a different association with clinical performance than students who score low on empathy. So you might be able to have a more nuanced view of what's happening in the sample. Implications of variable-centered analysis. So if we find that the association between empathy and clinical performance is positive, this can lead to, so evidence-based, you can make or develop a training to foster empathy among students, which will help improve clinical performance. And this is a one-size-fits-all approach. That means you use the same type of training for all the students. What can you do differently in a person-centered analysis? So it can lead to nuanced implications per subgroup. So if the findings show that the groups with high and moderate empathy scores have good clinical performance and a low empathy score subgroup has poor performance scores, the implication would be that students with low, moderate, and high empathy scores would receive different training programs. So you modularize the education, and this is a personalized or one size does not fit all approach. Further possible research in the variable-centered analysis would be provide empathy training to students in the same manner and study the effects. And for person-centered analysis would be provide tailor-made empathy training to the students in each subgroup and study the effects of this personalized approach. So this is how the two analyses differ from each other and what they can help us with. Now I would like to start. Is everything clear so far? Does anyone have any burning questions? We can pause for a minute to have any questions. Are there any questions in the chat, Anna, Marianne? Not yet.
No, not at the moment.
Okay, then I'll proceed with the rest. So I'm going to be talking about cluster analysis now. And so cluster analysis, the principle is, so this is a type of method which you can use for making subgroups. The principle is grouping of research participants or clusters on the basis of two or more variables, such that the participants in a group are similar or in a subgroup are similar or comparable, and the participants from other groups are dissimilar. And the aim and application, why do you do this? To bring differences to the fore and create group-based interventions. So if you look at the graph, so there is variable X versus variable Y, and you see different colors for the different groups that can be formed. And these groups otherwise would be invisible in a variable-centered analysis. So in a cluster analysis, you make these groups appear different and or rather you identify these different groups. There are two types of, or there are more types of cluster analysis. I'm going to explain hierarchical and partitional. So hierarchical clustering is an approach in which all data points are clustered hierarchically until only one cluster is left. So you start with the whole sample and you keep clustering things together till you end up with one whole sample. And then you get this diagram which you see, which is called a dendrogram. And on the basis of what you see in the dendrogram, you decide where to cut. So if you see the dotted lines in this diagram, then you see that there are 4 clusters. So you can decide to cut at where there are 4 clusters, or you can decide to cut where there are 2 clusters, or you can decide to cut where there are 3 clusters. So this is how hierarchical clustering is done. And this can be easily done in SPSS. And partitional or K-means clustering, this method sorts cases in a predefined number of clusters based on theoretical or practical considerations. So you have to have a strong theory to predict what kind of clusters you expect. So you run cluster solutions which start from 2 clusters until 6 clusters, and then you find which is the best cluster. But you also have a priori hypothesis on what number of clusters you are going to find. Then we go to, once you have the clusters, how to choose the optimal cluster solution. So based on statistical information, reduction of underlying variation within group versus between groups. So the total number of variation, which is variance, which needs to be explained by, let's say, a 3 cluster. If you want to take a 3 cluster solution, then it has to be minimum 50%. So if the cluster solution explains less than 50% of the variance, it cannot be accepted. So what you do is you run a cluster solution which is one more than something which is explaining 50%. So let's say a 3-cluster solution is explaining 50% or 55% of the variance. Then you try to run it with 4 clusters. Maybe it explains 65%. And then if you go and try 5 clusters and it explains only 3% more than 4 clusters, then it means that the 5-cluster solution is not the one you should go for. So you have to look at practical considerations, what the subgroups look like, and theoretical considerations for deciding.
This is the question on the chat, Rashmi. On the chat, people are asking for the hierarchical clustering. Do you use theory to help you decide on the number of clusters? And are there also pragmatic considerations for you consider in the cluster analysis?
Yes, the nice thing about person-centered analysis is always you can have pragmatic considerations, but there are also rules. For example, minimum 50% of the variance has to be explained for you to accept a cluster solution. And you also check for cluster stability and practical validity of the cluster. So that's where you can use your own judgment to decide whether you want to accept a 3-cluster, 4-cluster, 5-cluster solution. So for the hierarchical clustering as well as k-means clustering, it is the researchers who decide what is the optimal cluster solution based on
the computer or the statistical program offers you the numbers, and then you decide which solution you go for based on what makes sense with the theory. But there's a minimum, there's a threshold of what it has to explain minimum.
Yes, absolutely.
Okay,
that's well articulated. So 50% of the variance based on interpretability and applicability of the clusters, that's important. And how do you validate it? So is the clustering stable and reproducible? So if you run the cluster analysis again, will you come up with the same clusters? And if you test it in a comparable sample, will you get the same cluster? So that is something that you have to test. So just running cluster analysis is not enough. You have to test for the stability of the clusters. So the normal method is to split your sample into 2 random samples, and then check whether if you run the cluster analysis separately in each of these samples, whether you get clusters with the same cluster centers. I'm going to give you an example. So there was a article that we have published on motivational profiles and motivation for lifelong learning of medical specialists. So the 2 variables that we used for clustering were autonomous and controlled motivation. So autonomous motivation, as you can see the heart here, it means that it is someone who really likes the specialization that they are working in, or they find it very important. And the controlled motivation has to do with the prestige of the profession. So you are doing it because it is prestigious, because it gives you a lot of money, or external reasons, or internal or external pressure. So we found 4 clusters. And on the basis of theory, we accepted 4 clusters. Now, these 4 clusters, the first one, as you see on the right upper quadrant, is high autonomous moderate control. The second one is high autonomous low control, moderate autonomous moderate control, and moderate autonomous low control. And if you see the green tick, according to the theory, the high autonomous low control cluster in terms of outcomes is the best type of motivation to have. And then we use the cluster membership, that is 1, 2, 3, 4, as the independent variable, and we ran association with background characteristics. So then if you look at gender, you see that there are many more males in the moderate autonomous moderate control as compared to females, and there are more males also in the higher autonomous low control motivation, which is the desirable type of motivation. Then we also saw on the basis of age, what was the difference? We looked at academic hospital versus non-academic hospitals. Do the clusters, do the characteristics of what is the percentage of people as per their characteristics which are present in each cluster? And then we looked at experience, and we looked at surgical versus non-surgical specializations. So we actually could come up, we could look at, we got a cross-sectional view on who is in our sample, what kind of motivation do they have, and how are their background characteristics related to it. And then we tested this against their lifelong learning, what kind of scores they had on lifelong learning. And we had very interesting findings. So I would refer you to this article if you're interested. I will come to more details about this method in the breakout group. So now I would like to ask Marianne to take over and start explaining her slides.
Yeah, thank you, Rashmi. Yeah, so I will speak about latent class analysis, and then maybe Rashmi, you can give me the next slides if you would like to. So latent class analysis is also a clustering method, and classes is clusters or subgroups. It is an analysis that uses a statistical procedure like cluster analysis, but it has a probabilistic nature. And I will try to explain to you what that means. So you can use it to not to cluster individuals, but you are clustering indicators that say something about those individuals. And the clustering is made on the probability that an indicator comes together with other indicators. So you can really very well use it for analyzing categorical variables like human behavior in individuals. So I'm sorry, but there is some text missing now, but the categorical variables, descriptions of human behavior are that's very suitable to analyze that. And the output is that you will find classes that are not so obvious in your sample, and that's why they are called latent classes. The subgroups are unknown to you before you run the analysis. You also can find a latent variable, and that latent variable, that is the factor that distinguishes the different classes from each other. So there is a third output. I'm not sure that you can read it in this slide, but that is quite a wonderful aspect of this latent class analysis, because, as I said, we are clustering indicators of individuals. But in the last phase of this latent class analysis procedure, you can go back to the individuals by defining prototypes. So you can see which kinds of traits or behaviors or indicators of each individual have the highest probability to come into a class, and that you can relate back to individuals. So then you have prototypes of each individual in a class, and that helps you to really describe the individuals in the class. So maybe it will become more clear if I give you an example, and that's on the next slide. Because
Marianne, why do you have the picture on this slide?
Well, the picture, this is, well, what do we see in this picture? We do not know what we see. So if we are going to analyze what we see, maybe we can see different mountains or different sort of patterns in a landscape that we saw as one landscape, but there are differences in it. So I think that might be the explanation of this picture. So could you please give me the next slide, Rashmi? So we applied this method to a study in which we tried to find patterns in unprofessional behavior of students in bachelor and master programs in medical education. And first we went to the literature and found in the literature a whole list of unprofessional behaviors. And so that was defined based on the literature review. Then with that list of unprofessional behaviors, we went to evaluation forms of medical students who got an unprofessional behavior evaluation. So they were seen as unprofessional by their teachers, and their teachers gave feedback on the evaluation forms. And we tried to find the behaviors as described in the literature. We try to find those in the evaluation forms. And well, I can tell you more about this whole procedure in the breakout room. I certainly will. But this gave us 3 different behavioral profiles. And we saw in those 3 classes, those 3 profiles, we saw some behaviors that were apparent in all classes. And we found some distinct behaviors that were really specific for each class. So we found these 3 profiles, and based on these 3 profiles, we were able to define a distinguishing latent variable, which was the capacity for self-improvement and adaptability. So we found that that was the difference between the 3 classes. You can imagine that these profiles were important for how to remediate the students. So there was very clearly practical relevance of having these 3 profiles in our group. I told you about the prototype description, and that is the next slide. So when we related the indicators, so the behaviors, back to the 10 best fitting students in each class, then so we used the feedback for this of the teachers for that. We could make these sort of profile descriptions for each class. So yeah, I think you can maybe it's not necessary to read the whole slide, but I think the essence of this is that the feedback of the teachers in the evaluation forms was grouped into the 3 classes and gave us very specific information about the type of students which is in each class. And that is important to determine remediation for each of those classes. So I hope that you will join me in the breakout room after the plenary, after this plenary presentation has ended, so I can give you some more information about the specific procedures in this latent class analysis. Thank you.
Marianne, a quick question.
Yeah?
Would you, can you just quickly tell people how class 1 was treated differently from class 2 and class 3 in terms of remediation?
Well, I think that in class 1, you have students who are very willing to change. So they are very open to coaching, and maybe even the class 1 student is able to improve his professional behavior based on one conversation, because they have everything that is okay for them to improve for themselves. And so a class 2 student certainly needs some help from the teachers to improve, but okay, this is like practical help, because they know what the importance of the professionalism thing is, and they can improve with some practical help. Class 3 is the most difficult group of students, because they do not recognize what is happening. So here you have to work on insight and on adaptation, and it is not enough to give them like a practical course about organization or about whatever the people in class 2 need. So this is quite a different approach to help them.
So do you mean that if all these were thrown together, like people do in variable-centered analysis, we would have missed providing this tailor-made support to these 3 groups, these 3 subgroups?
Certainly. I think we really see that these 3 groups have different
remediation
needs. remediation needs. And I must say, we have, I saw someone asking for the reference, and I'm sorry, but this one way or the other, the reference is not visible in this slide at this moment. But if I think
we'll share the slides,
if we can share the slides, then you can see the reference. And so we had these 3 groups, which was published in an academic medicine paper. And later on, we validated these groups and also enhanced the model by discussing it with experts in the United States and in the Netherlands. And because on expert opinions, we came to even 4 groups, which are 4 different profiles of unprofessional behavior that are very, very important for the remediation that we would like to give. And if I can, of course, share the references with our chair.
One more question someone asked is, what software did you use for the latent class analysis?
Yeah, so we used Latent Gold, but there are some other software packages that you can use. You can use R. In the breakout room, I have like a list of 5 or 6 software packages that you can use to do this.
Thank you, Marianne. Anna?
Yes, well, I am here to talk about Q-sort analysis, which again, it's good to be the third one because there's a lot of shared aspects in our approaches. What you see now on the slide is something called a Q grid. And if you imagine it being empty and having little cards in your hand with all the statements, well, if you were a participant in my study, I would ask you to sort all these statements from the most extreme side on the red side, which is I disagree, to the extreme side on the green side, which is I agree. And you would have to choose by every card. Do I agree? Do I disagree? Which one do I feel more strongly about? And then afterwards, as a researcher, I put the statements into a software package, and I try to get clusters of types of students or types of participants that share certain ideas and convictions and beliefs. So if we can go to the next slide. A Q-sort analysis is a mixed method. You can click them all through, Rashmi. It's a mixed method approach. Oh, too far. And it's really focused on investigating subjectivity. So you're not looking for one truth. You are looking for how can you think about certain topics in different ways, and which different ways are there. So I'm now starting a new Q-sort project with a PhD student who's very interested in how people think about collaboration. Can you teach collaboration? She's very curious about people's ideas about this. So she's going to interview students and teachers to ask with lots of different statements, how do you see the teaching of collaboration? Can it fit into a curriculum? Can it not? What do you feel about it? What do you agree and disagree with? So you're not interested in one truth, you're interested in the spread of possible opinions, and then seeing again if there's patterns in the ways of thinking. So what is the output? It's a rich description of the perspectives in the study. And again, like in the approaches before, you will probably end up with a couple of profiles. And very much like what Rashmi explained, and actually anyone who's ever done a factor analysis, you are basically clustering people on statistical values, so people cluster together, but also, and that's where the qualitative part comes in, after people have put their cards in the Q grid, you can ask them questions. Why did you put that? Why did you think, I don't know, why did you think that COVID was good for the world, or was good for effective working, if that's your topic? So you can ask people for their motivations behind the cards. Or as a researcher, you can see when people were doubting about putting certain cards on the grid, you can ask them, oh, you were doubting about those 2 cards. Can you tell me what was going on? And the knowledge that you gain from these interviews, post-sorting interviews, can really help you in creating a rich description. So making a profile means looking at statistics, seeing, do I want to go for 3 profiles? Do 4 profiles make more sense? Are they distinguished enough? Do the numbers match up? What do we see in the interviews? And you end up with profiles of different ways of looking at something. So when should you not use it? When you just want the truth. That's not the idea. So a Q-sort analysis, we have an example here. This was a wonderful study from, yeah, we can go to the next one, Rashmi. Don't know why that was there. This is a lovely study from our PhD student, Jan-Willem Grijpma, which was published in Medical Teacher, where we looked at different ways that students perceived small group tutoring. Well, you can see that there was a group of students that were very focused. That's group 1 on understanding. They really wanted to understand what they were studying. They were really curious to dive into the content of their study. So they wanted challenging cases and they wanted motivating tutors to challenge them to find their answers. They wanted to learn. The second group, the green group, was very assessment oriented. So there was actually a group that clustered together around all the statements that were around assessment. They just want to learn for the test. So whatever they do in the tutor group, that's all fine, as long as it makes me a better student for the test. The third group was very group oriented. So I'm here to learn with my peers, because in the future we'll be working together as well. So I'm here for friends, for social network, for collaboration, for learning together. So they scored high on statements that were about the atmosphere in the group and the role of the tutor as someone who observes the group process. And finally, the fourth group that we found was very practice oriented. So they were very focused on, am I practicing things now that I will need as a physician in the future? So not the next test, not my friends, not the content, but is this useful for what I'll be doing in 5 to 10 years? So these are the profiles that we found in the Q-sort in this study. The link is actually on this slide, but you can't see it at the bottom, but you will find it in the slides as they will be sent out. In the breakout room, I will explain more about Q-sort and the different steps.
Anna, can you also just quickly say how would you treat these students differently, or would you not treat them differently? What is the importance of looking at these different subgroups?
That's a good one, because that's actually something that Jan-Willem, the PhD student who did this work, was also thinking about. I think one of the most important things for tutors is to know that these students are all in their groups. So it can explain, but if you are in a green group, you might get really frustrated if you've been talking about the group process for an hour and it doesn't get tested. So at least you have some understanding of where students' frustration might come from, or eagerness to learn, and to make it explicit and to discuss it with the group as well, to say, well, people that are very focused on assessment, this might be a difficult hour for you, and explain the reasons why you're discussing certain things.
Anna is frozen. Okay, let's go to the next slide. Yeah, we are anyway moving into subgroups, so I will stop sharing.
Others
right now.
might have to be patient.
Oh, Anna, we lost you for a minute.
Ah, sorry.
So I think now we are going to go for the activity in subgroups, and I'm going to. So Gary, are you going to make the subgroups, or shall I do the breakout rooms?
I have everything ready to go on my end. Are we
So
still going?
The 3 of us need to be in 3 different
Yep, you are.
groups. The rest can be random.
Yep, you are.
Okay.
So you still want to go for 30 minutes?
I think I would like to keep the last 10 minutes for discussion. So then we have, 30 minutes. We do have 30 minutes.
Okay. All right, I'm going to open the rooms.
Thank you. So I think we had a very interesting discussion in the breakouts. I think Marianne, Anna, would you like to say something about the discussions?
Well, I was hardly ready with discussing all the questions came up. And I must say, I forgot the recording.
Oh, I forgot that too.
I didn't. I'm the best student in the class.
Oh, I was so involved in explaining and everything that I completely forgot to record. I'm so sorry, Gary.
Yeah.
I think that what we would like to do here, I have still a few more slides to compare the three methods, but maybe we can just quickly get some hot tips from the three subgroups. So from our group, who would like to say something about what was discussed in the group? I should have asked in the group, but I forgot. Anyone would like to volunteer? No?
Well, I'll just add that you gave us excellent guidance on cluster analysis, and I think a very nice walkthrough, multiple examples that have given us ideas for our own work. So that was very helpful. I appreciate that.
Okay, thank you so much. I think what I could probably say, I had questions about how do you decide which clusters, what is the theoretical base, or how do you really make how do you make decisions on which cluster solution you are going to accept? And then I would say you look at the variance explained by the cluster solution. You also look at what is known in the literature and what is based on theory. And if there is you don't know much from there is no theoretical base, or there is no nothing known in the literature, then you look at the practical applicability of the clusters, and you also look at the stability of the cluster solution, and then you make, but it is the researcher's judgment on which cluster solution should be accepted. So that was our main discussion in the breakout room. Marianne, who in your group would like to say something about latent class? Or
Yeah, well, I would like to invite Kelly. Would you like to tell something about what we discussed? Is that okay for you?
I'm not the best person to make the summary. I feel like I did definitely got a sense of when this technique would be appropriate, and a little bit more in depth about the example that you shared in your earlier presentation. So I feel like I could apply this concept, this technique, in some of the work that I'm doing in order to identify some potential classes of individuals that perform differently in interprofessional education and collaborative care practice, which is what my area of research is.
Oh yeah, thank you very much. And Elizabeth, maybe you posted ook a critical remark, and maybe we can share that with all participants.
You're on mute, Elizabeth. You're on mute, Elizabeth.
I forgot once getting back into the large group, I mute again. So I don't know what critical remark you were thinking about, but I think the issue, one of the issues is the data that the information is drawn from. In this particular case, it was the evaluations that faculty completed on students, and they need to be prepared ahead of time to know what they should be paying attention to, because if there's data missing or it's messy, then the starting point for this analysis is also going to be messy. What I got out of it is some of the things one has to be careful about in terms of biasing faculty. For example, if you have a if you say a student is a certain type ahead of time, they need a certain intervention. It's very important to be more tailored to to have the interventions more tailored to individual needs. But on the other hand, there's the risk of biasing somebody against them. And finally, the issue of feedback, that the data that you get, you need to reevaluate it and see whether it really holds true. And so it's a circular process, I can see.
Yeah, so it's certainly the responsibility of the researcher to help, to get the data, information that is valuable for teachers. And Charles, do you like to add something? You can say no.
I don't thoroughly understand LCA. You did a very good job walking us through it. I still statistically, I don't really get the nuances quite yet. But one thing I think that I understand is that it really is a form of supervised clustering. In other words, you actually are using information that you have gathered from the literature and from other areas to actually help inform the way the clustering will happen. So as a form of, as opposed to completely unsupervised clustering where the computer does it for you, there is some sort of a priori application of linked events, of associated events, so that your clusters are sort of grouped. And then you test whether or not that is actually correct and statistically what the literature says, and you use that in an informed decision making. That's my understanding. I'm a little.
Start with a theoretical framework, and that's very important for the outcome. Yeah, sure. Well, thank you all. It was great to have you in the group.
Thank you.
Anna?
Yeah, I don't know who wants to speak up. We did a little queue, a sample queue. I can share the link on the chat if you want. So if people want to do a sample queue at home, it is a queue that is made by software developers about American patriotism. And you can do a queue sort yourself to experience what it was like. I don't know who wants to share something. We've got Rob, Steve, Mary, and Rogaye.
I think there were a couple of interesting takeaways as we responded to doing a sample Q sort. One is that the statements themselves, we talked a little bit about the maybe opportunity when they are provocative or when you have reactions to them, but also maybe that feeling of being forced to rank and what that both feels like and looks like. But certainly the opportunity is that follow-up, so that there's an interview, there's an opportunity for that participant to share why they agree, disagree, what they think about any particular statement. And that itself is a very rich portion of this methodology. So I appreciated getting some and appreciation for that.
For our study, it was actually some of the interview data that helped us find the final factors and descriptions of the profile. So it's a real combination between qualitative and quantitative.
Yeah, and ideally, not ideally, you can do a Q-sort study without doing post-analysis interviews. But we, from our experience, we can say that the interviews were very, very they gave us a nuanced picture. So I would always recommend people to do interviews. So you can do online Q-sorting as well. But then it was, it's harder to interview someone when you have not seen what decisions they made and how they made it. Yeah. So we would recommend that you follow it up with post-sorting interview. Yeah. And so that was thanks a lot for all the key messages and tips. One of the things that we also discussed in our group was what if you find something different from what the theory says? And that's absolutely fine, because data doesn't lie. So you need to dig deeper into the theory to understand it. And I gave an example in the group, and that was when we looked at the medical specialists, the group was different in all other students and all different cohorts of students or all different years of students. We had found very similar profiles of motivation, that they were low on one and high on the other, or low and high. But among medical specialists, we did not find a low autonomous motivation profile. So we realized that because specialists are working in their field for such a long time and they are dedicated to their field, you don't see a low autonomous motivation group at all. So that was a nuance to the data, which actually a deviation from what we had expected, but we could explain that on the basis of theory and on the basis of practical considerations. So it is very much possible that you might get a different type of clustering, which is different than what the theory says, but which means that you have to dig deeper into the theory to understand why it is happening so in the sample that you have run the test. So that would be my last sort of message. And we have only 2 minutes. So I'm wondering whether I should still show you the comparison slides, but the comparison slides are also there in our article. And I will be sharing the whole presentation with Gary and he can send it to everyone. So Gary, would you rather that I end the show now, or would you want me to show the last 2-3 slides?
You can do whatever you want to. I leave it to the group.
Okay, then I will share quickly the last slides. Why am I not seeing this? Sorry, just a minute. I need to check why it is not looking proper. Yeah, this should be okay. Yeah. So this was what was discussed inside the groups. And then I have last 3 slides. So take home messages, cluster analysis, latent class analysis, and Q-sort analysis are person-centered analysis methods which they complement variable-centered analysis. They do not replace variable-centered analysis, which has its own place in our research. And this person-centered analysis promotes personalized approach towards teaching, supervision, assessment, faculty development, whatever activities you can think of in medical education. And this is my group, and I would like to thank them very much for all the work which helped us get this perspective of person-centered analysis through everyone else's research projects. Okay, thank you so much. So these were our key messages. Thanks a lot for your participation. We really enjoyed ourselves. Thank you, Gary.
Thank you.
Thank you.
Thank you.
Appreciate you guys
Bye-bye.
taking time to do this.